Hello everyone and welcome to Module 9. So this week we only have one chapter to talk about, which is kind of nice. A little change of pace for you. We're going to be focusing on Chapter 40 this week. And Chapter 40 is talking about pediatrics. So let's go ahead and dive on in and get our discussion on this chapter. So a pediatrician is a physician who specializes in the treatment of newborns, infants, children, and adolescents. This means that they'll treat patients anywhere from birth to age 20. When you're working as a medical assistant in a pediatric office, you really need to understand the unique characteristics and some unique considerations when working in these offices. The first vast difference that you'll run into is the communication piece. You cannot communicate with children the way that you would an adult. Sometimes they just don't understand those things. So when you're communicating with a pediatric patient, there's really some things that you should consider doing. First and foremost, smile. Kids sense fear, so if you come in with a smile, that will help to relax them. You want to actually have a communication on their eye level. Get down on your knee. Talk to them so that way they can look you eye to eye. It's such an important piece, even if it is, just a child and you think it doesn't matter. That does set up future visits for success. Speak gently and calmly. Don't come in with a whole rage of terror. Speak to them in a normal manner, but make sure that you're using words that they will understand, okay? Never lie to a child, okay? Again, they know, and they will keep that in the back of their mind. So, never lie to them. Be as truthful as you can. And take time to allow them to role play. Allow them to play with your stethoscope. Allow them to play with the blood pressure cuff or the bladder of it. Let them see the measuring tape that you're going to use. Let them play with the weight as long as they're not harming anybody or themselves. Allow that, because when you role play with them, what happens is they become more comfortable with coming to the doctor's office. And most of us have kids. We know that is not a fun experience. So taking that time, allowing them to touch some of the items, will lessen their fear about coming to the doctor. When you're working in a pediatric office, you want to make sure that the exam room itself is bright, it's welcoming, it's interesting to a child. That means using those brighter color palettes instead of the warmer, cooler colors. You want to make sure that you've got characters on the walls, or maybe you've got fun little mirrors where they can look at themselves. Make it so it's exciting for that child. All right, let's discuss the pediatric patient now and how they differ from adults. So when we're talking about pediatric patients, we really look at their growth and development, and that helps us refer to any changes that they will go through as they grow and mature. Development refers to not only their motor skills, but their mental and their social skills that they have. It's important to know that children will mature at different stages and at different levels. Not all of them will grow at the same time in the same pattern. But if we start to notice that there is a problem, the earlier we detect the problem, the better the outcome is for that child. Generally, after a baby is born, what we do is we assess them and we screen them on what we call an APGAR scoring. This is where we have a method of evaluating the condition of the child at 1 minute after birth and 5 minutes after birth. The higher the APGAR scoring, the healthier the baby really is. As a medical assistant, you will be assisting the provider with pediatric patients by obtaining their vital signs and their measurements, just like you would if they were an adult patient. Some of the measurements might be different than adult patients, and some of them might not be necessary like they are with adult patients. Your pediatric patients will come in for what we call well child checks shortly after birth, generally about a week, at 1 month, 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, 24 months. After that 24-month mark, they will then come in yearly, unless they're ill. At each one of those well child visits, you want to make sure you're taking measurements of height, weight, and head circumference, as well as chest circumference. Then the vital signs you'll want to take are temperature, pulse, respiration, and blood pressure. So let's go ahead and take a look at each one of these. When we're talking about taking a height on an infant or a child, it's different than that of an adult. Adults, we would use the standing scale to obtain their height. For children, you really want to measure them on the exam table, just with a ruler, until they're able to really stand on their own on the adult scale. When we're taking a patient's weight, you really want to do this without the diaper on, so you do make sure that you get the most accurate weight. Diapers could be full, and those will actually add weight to them. So even if the parent has just changed their diaper, always make sure you remove that. Head circumference. The reason that we do this is to actually monitor the growth of the baby's head. If growth is too rapid, it could be an indicator of hydrocephalus, which is excessive fluid on the brain. It's not a good thing. But neither is the opposite, where we feel like the head isn't growing as fast or is falling below a normal range. This disease is called microencephaly. Chest circumference is not something that is normally done at every well visit or every office visit. It's generally only performed when the physician suspects or thinks that the patient may be under or overdeveloped in the heart or lungs. Temperature will be taken just like it would for adult visits, except for the fact that in children under the age of 5, you want to make sure you're using an aerial temperature, a temporal temperature, or an auxiliary. After age 5, you can take it like a regular adult orally, or any of the others that were mentioned. Pulse rates for children under 2 will be measured using the apical route, so placing your stethoscope over their heart. And really, it's important to know that the pulse rate for children and newborns will be extremely high. I think it's somewhere between 100 to 150, but then will decrease as the child grows older. Respirations are the same. You're going to take them over the apical of the heart. Children do tend to breathe a little bit more rapid. So again, when you have newborns, they're going to generally have about 30 to 60 breaths per minute. And as they get older, those breaths actually slow down. And lastly, we have blood pressure. Now, this is really not required on our pediatric patients. The only time that it is required is if the child has a cardiovascular or kidney disease, and we'll generally start taking that blood pressure after the patients turn 5. Alright, so that's kind of the overview that I have for you this week. As always, I encourage you to make sure you are reading the chapter in full, so that way you can be more knowledgeable and have a good understanding of the written assignment for this week, the discussion boards for this week, and the quiz. So your discussion board for this week is actually focusing on the body measurements of your pediatric patients. You will need to explain how to properly measure height, weight, and head circumference. And you will need to state how you think it is best to obtain those measurements and how you will educate your patient as you're taking those measurements. As always, your initial post is due Tuesday by midnight, and your 2 responses to your classmates are due Saturday by midnight. For your written assignment this week, we are focusing on pediatric immunizations. You will need to submit a 2-page APA formatted paper that highlights and answers all of the bullet points that are part of this assignment. You can find those all on the Angel platform under the written assignment. There are several bullet points, so please make sure that you address each one so you can receive full credit for this assignment. This written assignment will be due Sunday by midnight. And lastly, you have your quiz for this week, which is going to be based off of Pediatrics and Chapter 40. This quiz has 10 multiple choice questions with a 10-minute time limit, and it will also be due Sunday by midnight. I hope you all have a wonderful week, and I will see you Tuesday. Bye, guys.